Researchers at Johns Hopkins University say a type of bacteria found in severe gum disease may trigger many cases of rheumatoid arthritis, an autoimmune disease caused when the body mistakenly attacks healthy tissue in the joints and sometimes around the heart and lungs. The bacteria is called Aggregatibacter actinomycetum comitans, or AA for short. The researchers identified the bacteria in close to 50% of the patients with rheumatoid arthritis. The bacteria damages immune system cells called neutrophils, which then attacks them. They say it is the same process that appears to trigger the inflammation seen in rheumatoid arthritis. And while there is no immediate takeaway for patients who have rheumatoid arthritis, the researchers advise better oral hygiene. Now, in another research on arthritis, doctors in the Netherlands claim a new treatment could offer life-changing pain relief to thousands of people who suffer from arthritis. The treatment comes in the form of a tiny electronic implant, which is embedded under the skin. The vagus nerve carries messages between the brain and the body's major organs. The implant rests against the nerve in the neck, firing electrical impulses once a day for 3 minutes. The researchers say that's enough to reduce the activity of the spleen, which regulates the immune system. They say within days, the organ produces fewer chemicals and immune cells, which cause inflammation in the joints of people with arthritis. In some patients, swelling completely disappeared. Now it's time for our studio guest. Rheumatoid arthritis affects joint linings, causing painful swelling over long periods of time. And the inflammation associated with rheumatoid arthritis can cause bone erosions and joint deformity, among other things. Joining me for more on arthritis is Aida Murad, an advocate and a young woman living with arthritis. Ms. Murad, welcome to the show. So when we hear about rheumatoid arthritis, we think about the elderly, but in your case, you were diagnosed at the age of 20. What was it like?
It was very scary, and a lot of people didn't believe that I had rheumatoid arthritis, including myself, doctors, and some friends. They said, you're too young to have it. It just take some ibuprofen and brush it off. And 7 years later, I still have it.
And did you have some indications that something was wrong before the diagnosis?
I stopped being able to use my hands, so I said something's wrong, and then slowly it hit my feet, and then slowly my elbows, my chest.
And when you see that you have the pain, right, when you have flare-ups, as they call it, what is it like? Can you describe for us what it's like a typical flare-up?
So first I have bone erosion in my left hand, so it's been 2 years since I closed it, and that's very difficult. I have flare-ups in my chest, which feels like having a heart attack. I went to the ER telling them I have a heart attack, then they said, oh, you just have inflammation there. In my elbows, you can no longer do ordinary things such as dress up. If it's on your feet, you can't walk easily. And if it's on your back, you have to stay in bed.
But that sounds debilitating. How are you able to function? What is your treatment regimen like?
I've tried Eastern, Western medicine and functional medicine. So far, nothing has been sustainable. But first, I take care of my emotional health. I make sure stress hasn't caught up to me. I sleep enough. I eat very healthy. But then when I have flare-ups, I try to stay away from gluten. I take ibuprofen sometimes, and now I'm just trying some supplements to see if something works.
And you said you try to stay away from stress. Is stress one of the triggers, or I heard about the cold weather, is that?
Cold weather definitely doesn't help, so I might migrate somewhere during the winter. But stress is definitely a flare-up for all illnesses. It lowers your immunity, so I try to maintain a fulfilled and as much as I can stress-free life.
Yeah, that's very, very interesting there. Because when you look at where we are in terms of treatment, research and development, in my reports earlier, I talk about some research. As a patient, someone who's living with arthritis, what do you think is still missing? What would you like to see?
The root causes of arthritis are not known. And finding that would, I think, help so many people. And then also raising awareness that there are many youth being affected with this, and it's rising. And then third is finding solutions without such serious side effects. That's why I stopped, for me personally, Western medicine, because they caused me serious side effects, headaches, nausea, dizziness, inability to focus. So finding the root causes of
Yes,
things.
so Western medicine didn't work for you, but it worked for other people. So it really depends.
Yes.
It's from patient to patient.
Exactly.
And now you are an advocate. What is the message? What kind of awareness are you trying to raise? I know you mentioned about the root causes, being able to find the root causes, but what is your message in general?
We have to take the full picture. You have to address the physical self, emotional, mental, and spiritual self, because they're all interrelated. So if you just address the physical, it's not going to be sustainable. And then second is just for people living with arthritis. I wish I could tell my younger self it's going to be okay. Even if you don't find the solution right now, you will. So be patient. And I'd like to work more with people to find sustainable solutions.
And quickly, in a few words, what is the most difficult living with arthritis?
Walking. And honestly, for me, it's being able to be vulnerable about it and tell people that I'm not doing well.
Well, Aida, we wish you all the best. We wish you strength and good health. Thank you so much for joining us. And that's Aida Mourad. She is an arthritis patient and an advocate.